Ma'am, is Thakkar sir also ready?
Yes, we can see him.
Okay. So, ma'am, another 2 minutes and then we'll start the session.
Can you see my slides?
No, ma'am, I can see you.
Can you see my slide now?
Uh, no, ma'am.
Okay.
You need to go to the screen sharing option, ma'am. Ma'am, now it's there. Now it's there on screen. I think we can start the session now. A very good morning to all. On behalf of Dharmashastra National Law University, Jabalpur, I, Dr. Isha Vadva, welcome our honorable guest speaker of the day, Professor Dr. Ranita Nagar, Madam, and Dr. Hitesh Kumar Thakkar, Sir, and also welcome all the participants. It is well known to all of us that this pandemic brought along with it some unprecedented situations which demanded prompt actions from the part of executive and government officials. Considering the same, the debate of excessive governmental control on individual rights, especially those affecting the economic setup of the nation, continues to be the most deliberated issue. Some considered it as an essential step on the part of government for the sake of protecting the cause of national health. However, the amount of those who consider such excess restraint unreasonable is also significant. Therefore, to provide an insight to this, with special reference to the national economic system, we have with us such guest of eminence. Dear participants, it's my honor to introduce the first speaker of today's webinar. We are indeed privileged to have noticed academician Professor Dr. Ranita Nagar, Madam. Madam is the Center Director of Center for Law and Economics, Professor of Economics at Gujarat National Law University, Gandhinagar, India. Other than this, she is also member of Accounting Association of India and Vice President and founding member of the Indian Association of Law and Economics. Madam started her journey of academics in the year 2004 and has completed 16 bright years in teaching and research. She has made noteworthy contribution in the development of the discipline law and economics. Madam is an expert in designing new courses. Her area of interest is developmental economics, institutional economics, gender studies, behavioral economics, and yes, of course, law and economics. She is also the editor of books published by the Center for Law and Economics, Gujarat National Law University, Gandhinagar, India. We also have with us today, Dr. Hitesh Kumar Thakkar, sir. Sir is a member of Center for Law and Economics, Assistant Professor of Economics at Gujarat National Law University, Gandhinagar, India. Holds more than 10 bright years of teaching and research experience. He holds PhD degree in the subject of economics and law. His area of research interests are macroeconomics theories and practices, global financial regulatory system, global financial crisis, global financial integration, NPA's legislation, money, banking, and public finance and law and macroeconomics. He has edited three books, that is Law and Economics in India, Understanding and Practice, Economic Analysis of Law and Indian Perspective, and Maritime Security and Piracy, Global Issues, Challenges and Solutions, and presently working on book NPA's Legislations in India. Sir is actively associated with research, training and extension activities in the Center of Law and Economics at Gujarat National Law University, Gandhinagar, India. Once again, on behalf of Dharmashastra National Law University, I welcome our honorable speakers of the day. And now, I humbly request Dr. Ranita Nagar ma'am to kindly start with the session.
Professor Isha Vadvan, thank you so much for the very, very generous introduction. On behalf of Gujarat National Law University, I also thank Professor Balraj Chauhan for the kind invitation with regard to this session. I also welcome and thank all the participants today, esteemed participants. It's a huge sense of responsibility. The topic that Isha, asked me to speak on, being economic analysis of government restriction on individual rights. So I speak with a lot of responsibility because one, it's one of the biggest humanitarian crises that we are looking at. That is first. Second is there is sharp debate on the correctness or the completeness or the inadequacies of the policy prescriptions. I also wish safe health to everybody, all our attendees today and everybody. To go on with the discussion at hand, my very, very favorite point of discourse is that we are in the 21st century and we have to start thinking and looking at an issue from a scientific perspective. Therefore, my first slide says from the age of belief to the age of reason. We cannot be having arguments that we had 2000 years back. Arguments like something is unprecedented, something is too big to handle, governments are not equipped adequately, economy is weak, it's a poor country. So those arguments from the onset, I would like us all to be tuned into the fact that we are in the age of reason, not in the age of belief. And the first point on that is a brief study of the last 100 years will tell us that there is one epidemic or pandemic every 10 years. So therefore, it is not something that the corona and the immense cost that the virus has inflicted, I would not agree that it is unprecedented. I would say that there could have been possibilities of understanding the dimension of the problem. Why? Because every 10 years we have a case study on different kinds of virus and the kind of relief and response that is required. And the minute we start looking at what are these marks that are coming on the slide?
That's what, ma'am, I was about to ask you. That is there something that you're doing at your end, ma'am? We are not doing anything on the screen.
I don't know. It came and it went. I hope it is like the pandemic.
Yes, ma'am.
So when I start talking about the age of reason, I talk about the age of scientific inquiry and solutions, not the age of normative idealism nor the age of idealistic humanism. We don't need to speak from the point of empathy or sympathy. We need to speak from the point of science. Science is X possibility, there is a probability of the possibility, and therefore there is economics and mathematics. It can be estimated, and it can be estimated very, very accurately. I am very hesitant to understand the positions taken which say that, well, the size of the problem could not have been estimated. I am not in agreement with that because our science has gone so ahead. There is nothing that science and technology cannot achieve today. And therefore, if we go back on the last 100 years, we have ample case studies to be able to understand the possibility, and especially with all the environmental concerns. So that's it. Looking at something from a scientific inquiry and thinking about scientific solutions brings us into the relevance of law and economics. Why? Because economics will give you the tools, the principles, the concepts to be able to break down an issue into rationality orders, preferential orders. You have a set of microeconomic tools to be able to do that. You can look at an indifference curve and say that, okay, this is the amount of harm that has been imposed, and these are the costs that are required to address those harms. And so, from a law and economics perspective, if you look at the laws that were invoked in order to address COVID, we are looking at the Epidemic Disease Act 1897 and the Disaster Management Act of 2005. And it is under these two laws that we talk about the various interventions on individual rights that came from government action. Having said this, I'll move towards a very micro point that I'll try to make because it's a very, very diverse and a very wide area. I'll try and look into the pandemic from the economist perspective of a Pigouvian model and a Gaussian model. When we say a Pigouvian model, we understand what the Pigouvian tax is. The Pigouvian tax is typically an instrument to address an externality. So let's say, for example, if there's pollution that is taking place, then there is a Pigouvian tax that is imposed, which minimizes the externality by making the the originator of the externality to pay for the externality that is created. So one possibility is one possibility is to look at the lockdown as a Pigouvian tax. So all the rights, all the fundamental rights that we enjoyed as citizens of India come to a halt, come to a standstill, because it is 100% Pigouvian tax that is imposed by the government. And the other extreme possibility is the quotient model. We know the Coase theorem. The Coase theorem says that there is no need for any form of government because national decision makers will assess the costs and benefits of those rights and accordingly either eventually give up the right or come to some agreement between the transacting parties such that efficiency is improved. That is the idea of quote. We must also remember that the quotient model typically works. So when we do not want government interventions and we are talking about Coase theorem, then Coase theorem would work in a market exchange. Typically in a market exchange model, the Coase theorem would work. Of course, the provision of Coase theorem is that transaction costs should be zero or transaction costs should be minimum. Only then efficiency can be reached. Clearly, in a case of pandemic, we see that the transaction costs are huge. I'm sure we have an idea of what transaction costs is when property rights interchange or any form of rights. Rights are resources. In economics, rights are resources. So when rights exchange, then the cost of exchange of the rights should not be so high that the benefits of the exchange get eroded, which means that scholarship on COVID.
Ma'am, there's some kind of disturbance. Just
Not
one
at
second.
my end, not at my
Yes,
end.
ma'am. I request all the participants to kindly mute themselves. Participants, you are requested to mute yourself first.
All right, thank you.
Yeah.
I understand that it is, we are in our home environments, and there are, uh, let's say, internal disturbances in home environments also, just like we applied the Epidemic Disease Act and the Disaster Management Act based on the concept of internal disturbances. So internal disturbances are not just for a country, they are in a micro sense for a home. So that's perfectly all right. Yeah, so clearly I want to talk about is the Pigouvian model of lockdown, which is 100% tax, which is erosion of all rights, versus a quotient model. A quotient model, like I said, if the transaction costs are low, then exchange of the rights will happen efficiently. But the transaction cost of the exchange of those rights have to be zero or minimum, or at least that much that the returns from that exchange, the benefits from the exchange are way higher than not having the exchange taking place. And quotient model would work for a market economy. So these are the two extremes. Pigouvian tax would mean complete government intervention and complete restriction of individual rights. Whereas on the other extreme, we talk on the quotient model, we say that no, we should not have such a strict lockdown and so much of intervention on individual rights. To a large extent, what we saw in the US, what we saw also to an extent in South Seoul, this is that, all right, with certain guidelines, people will determine their behavior. When you say people will determine their behavior, it means people are exchanging their rights, right? I determine not to go out. You determine if you have flu, you don't go to the mall. So these are exchange of rights. And these exchange of rights are typically an exchange in market. So market is not necessarily a shop where you and I are buying. It's an exchange mechanism that is happening across. Those exchanges create value, and that is why we are so much in favor of the market exchange model. So these are the two extremities, and in between there are degrees and there are mixed strategies. So Pigouvian model of lockdown, India. Quotient model, where you have very, very relaxed interventions. Therefore, we have to understand the intervention of the government on the Pigouvian intervention of the government on both these models in different degrees, and therefore its impact on the fundamental rights in different degrees. So we understand that if it's a Pigouvian tax, there's a total restriction, and if there is a quotient model, there is complete relaxation, whereas the reality is in between. All right. we must also understand this, that what we understand as fundamental rights is understood as resources as far as economics are concerned. Rights are resources. And rights, as enshrined in the Constitution, are equal before law, but the rights that are implemented or executed by individuals are not equal. We have to make this distinction very clear. Fundamental rights, as enshrined in the Constitution, are equal for all. Having said that, the devolvement of the fundamental right, the value of the fundamental right across a heterogeneous set of people is different. The very simple way of understanding this would be, it could be the idea of right to health versus right to livelihood. Now, both would look equal to us, but a heterogeneous population of 138 crore manifesting from various different levels of income would be valuing their right distinctly, separately. Which means when you talk about the exchange of rights in the quotient model, which is with minimum restrictions or not a severe lockdown, not a total lockdown, in that scenario, it's not necessary that everybody will be valuing their right to health and life equally across 138 crore population of India, because there are heterogeneous costs and benefits of restriction of rights across 138 crore. So exchange of rights in a quotient model cannot happen because everyone is valuing that right separately, differently. If I value my fundamental right to livelihood more than my right to health, then I will uh, not follow restrictions. It's as simple. It's a cost benefit scenario. So different income sections will be valuing their costs and benefits with regard to a right differently. Having said that, they're enshrined equally as far as the constitutional right is concerned, but when it comes to execution and decision making, individual decision making, then across 138 crore population of India, which is classified as a lower middle class income by the World Bank June report, we are a lower middle class income, which means that the exchange of rights in the quotient model will not lead to efficiency, because valuation of those rights are very, very different for the heterogeneous set of population. Also, given the level of inequality in India, we also have another argument to make, that it is a distinctly heterogeneous population with regard to income that we are talking about. So, rights are not homogeneous. Rights are homogeneous as long as enshrined in the constitution. But a right for me is a resource, a right for you is a resource. You value it differently from anybody else would. And since we come from a heterogeneous population, our estimation of rights would be very different. And therefore, the quotient exchange, as far as rights are concerned, which means that I will voluntarily not, I will voluntarily surrender my right because I value health and safety equal to how you value health and safety, is not going to happen in a quotient market exchange model. And therefore, to my mind, there is absolutely no doubt about the fact that it was a Pigouvian lockdown model that was essential, mandated as far as this pandemic is concerned. A few more points other than the impossibility of quotient exchange. See, when we look at PIGU and when we look at COS, what we are saying is this: which is the least cost model? So, from an economist point of view, efficiency would be entailed given a model or various alternate models. Model A, America, Sweden, New Zealand, Seoul, India. These are models. These are strategies. These are economic strategies. Uh, Different economic strategies. Point is, uh, each of these strategy has a different cost. Another point is, those who have an understanding of law and economics would say, well, these are all costs, but you know what? Your efficient strategy would be a strategy that minimizes the aggregate of the social cost. Strategy that minimizes the aggregate of the social cost is an efficient strategy. So what we have to do is we have to break down the alternate strategy. A strategy which would be like the Pigouvian 100% tax lockdown model, or the extreme a quotient model where people voluntarily exchange their rights and determine for themselves on rationality. And I just now told you that, hello, we are a heterogeneous population, so it is impossible for us to be trading our rights. I mean, I know we don't want to talk about fundamental rights as trading of rights, but that's the fact. Rights are traded. Even fundamental rights are traded, isn't it? So quotient model can work. Maybe it can work, but definitely not in India. A few more reasons why the complete lockdown was essential. Without so if the costs of lockdown are more than the costs of the intervention on individual rights, then it is an inefficient model. But if the benefits of the lockdown are greater than the costs of the lockdown, then it is an efficient model. So that's what we're talking about. So we're talking about a few alternate strategies. To my mind, a huge reason that justifies the government restrictions of individual rights is the phenomena of market failure, as we understand in economics. Market failure originates from actions of individuals that create negative externalities. Now we know what negative externalities are, wherein your action, you don't pay the price for your actions. So if you don't pay the price for your actions and there are spillover effects, I go to the mall, I'm infected. I don't pay the price for my action. I might be young, I might be asymptomatic, my immune system might be very strong, but I have created spillover effects wherein there could be an elderly person, there could be people with comorbidity who have got infected. So the price that I pay for my action is not internalized, is something that will create a negative externality. Clearly, the pandemic COVID-19 is a case of negative externalities, and it is impossible for the individual to assess the cost that he or she is imposing because of his actions and internalize that cost such that the individual takes rational decisions as per the requirement of the times. That means self-restricting to the maximum. So self-restricting will happen when it will happen only when I am made to internalize the cost of my actions. So if an individual is not internalizing the cost of his actions, the individual is creating negative externalities, and these negative externalities, we know the dimensions of these externalities are very large. So this is a prime justification for government intervention, because these negative externalities could not be addressed by private law, could not be addressed by private rationality. Also, the fact that public health is a public good. Now, there's enough literature in economics which tells us that public good is under supplied when it comes from private sources. It is only the government through its public health programs that can create adequate capacities, whether they're testing, whether they're tracing, whether they are quarantining, can only happen from the government, because they enjoy the economies of scale. Economies of scale are the requirement for the dimension of this size. And very importantly also, which might be rebutted by my honorable speaker, is the question of information asymmetry. No private agency would be in a position to inform correctly, to create equal. I mean, we saw so many instances. I mean, people who could not even, work with their mobile phones, were migrant laborers who did not even know how to book their tickets, and so on and so forth. So that's a very small example of information asymmetry. Larger example is, well, nobody really knows how the infection spreads and what is the magnitude and all of that. So information symmetry is something that can be only provided by the government. So that's a huge reason for completely agreeing with the lockdown. This would be an graph that everybody would be familiar with. This is typically that is understood in terms of economics of tort. So when I say minimizing of social costs, so if you look at the the uppermost curve, it is the social cost of both, social cost of preventing the spread of the epidemic, and the social cost of of the spread of that epidemic. So both together, whichever strategy, model 1, model 2, model 3, model 4, model USA, model Sweden, model New Zealand, model China, model India, whichever is in a position to bring this curve at the minimum is the efficient is the efficient proportion of lockdown. So on the horizontal axis, you're looking at the degrees of lockdown, complete lockdown, Indian model versus the different. Wherever it is minimum, it would be the efficient model of restrictions and intervention on individual rights. What are the other two curves? The other two curves would be the cost of the precautions that are taken, the benefits of the precautions that are taken, and on the other side, the opportunity cost that is created because of these precautionary measures, which in this case is the question of lockdown and restriction and phases of unlock also. It is not just lockdown, but it is also phases of unlock that we're talking about. So if you look at lockdown, then benefits of lockdown, if you want to break down the benefits of lockdown, we see reduction in the spread of disease, reduction in the cost of asymmetry information, reduced patients in the hospitals, so hospitals infrastructure is not overwhelmed. On one side, these would be I'm sure we have various more variables, but we are not sitting here to do a complete statistical data driven study to exactly tell us that what is the would it be 100 or would it be 200? That is not what we're doing. We're just giving a theoretical framework. So these are the benefits of the lockdown. There are also costs of the lockdown. So enforcement costs. I'm sure we will have data coming out. What were the enforcement costs for 3 months as far as the lockdown was concerned? Closure of economic activities. That is the hand-in-hand cost that happened with lockdown. The tax revenues that fell phenomenally as far as government revenue is concerned. The loans that the government has to take and the cost of servicing these loans. These would be the costs of the lockdown. So a total lockdown, the Pigouvian model, benefits and costs you break down, you will come to a number that says that, okay, this is where the social cost of the pandemic is minimized. So remember, social cost will therefore take all these criteria into consideration. Clearly, the benefits of the lockdown, if you have data, I hope this is a wake-up call, and sometime we have the data, which clearly shows that, okay, at least 1 year down the line, that these were the benefits and these were the costs, we would have a better understanding of how to view the steps that were taken in the course of the pandemic. If you look at another variant of restriction, let us say relaxed restrictions. So relaxed restrictions would be a different model. It would be working on a different plane. For example, the strategy would shift. It would be costs of massive testing. It would be identifying and undertaking targeted quarantine. So not the way we did, and we quarantined entire districts and areas. So those could be the relaxed restrictions in terms of costs. And relaxed restrictions in case of benefits, a very, very large phenomena would be economic activities can continue. And finally, of course, you have to look into the marginal costs and marginal benefit of the total lockdown versus the marginal costs and the marginal benefits of the relaxed restrictions, which is a spectrum between the Pigouvian 100% lockdown and the Gaussian model. And more importantly, one cannot look at the pandemic from a ad hoc analysis. It would not be complete. So we have to look into the ex ante and the ex post possibilities of the restrictions that were imposed. So, lockdown in an ex ante, I'm sure there will be questions that will be asked that you're so much in favor of the lockdown because you said that it is a market failure. At this point, I would also like to bring in this issue that by over the last 40 years, we have pretty much privatized most of the economy, and therefore, when we say a market failure, then we also have to question that why did the market become 80% of the economy? So that is a very, very big question. So if you look at an ex ante possibility, yes, lockdown was necessary. Like I told you, I gave you the reasons for that, but related preparations were equally necessary. So if you have the information right in December, we could have made preparations in terms of better preparations. I'm not saying preparations were not made, it's a huge issue. But then going back to the age of reason and the fact that, well, every 10 years we do have a pandemic, then preparations in terms of distribution of ration, provisions for informal and migrant workers, health infrastructure, etc. If last 40 years neoliberal policies were not so aggressive, then we would have had better preparation for the lockdown. So what I'm saying is lockdown is justified. What I'm saying is that the preparations, and not just preparations from December of 2019 to March of 2020, what I'm saying, preparations down the last 40 years in terms of public health, public provision, wage security, so on and so forth. So that ex ante preparation, had that been in place, the lockdown would have had better results and would have minimized the cost. So this is what I was trying to say, the neoliberal policies over the last 40 years. And so restriction of individual rights is not something homogeneous. We all look at it, we all value a right differently. It would not have been possible for private players to value the right and voluntarily exchange the right. It was necessary for government intervention. But the discussion has to be placed in the format of, this is the age of science. We cannot defend by saying that it was unknown because US also did not know. That is not good enough. Well, US did not know primarily because US has been on an all-out neoliberal policy way more than India has, and therefore it does not have sufficient structures. Is it impossible? Clearly it is not. A small country like Cuba has done a much, much better job at containing the pandemic. A small state like Kerala has done a significant work. So it is not impossible. There can be systems and structures that can be created. So the discussion has to be put in that light that, well, lockdown was necessary. The extent of marketization because of neoliberal policy was not, and therefore I call it a market failure. Lockdown was necessary, but ex ante preparations not from December of 2019, but the last 40 years is what I call ex ante preparations. And if ex ante preparations were done, then the cost of the pandemic would have been way lower. Maybe we would, just loudly thinking, a global scientific community with a global funding. For what purpose? Not technology, just science, pure science. Not technology which is application, commercial application in the market, but pure science. Like, okay, global scientific community, maybe World Health Organization, sit and work on the possible strains of virus that can erupt. Given the fact that last 100 years we've had 10 such epidemics, funded by a global funding source, I'm sure we would have been way closer to a vaccine. I'm not saying that we would have had the vaccine, but maybe if the global community just does this scientific research on thousands of strains of viruses that are possible, it would have been. The point is that science could have made it possible. Number one, economic policies could have made it possible across the last 40 years. Made what possible? Made the cost of the pandemic lower. And but it's a huge wake-up call. This is the time that we realize that wars are not just won by expenditure on military. wars are won by expenditure on public health system. We still have about 2.5% of the GDP on. So this might be the final wake up call. But I'm sorry. I'm sorry. Things. So let's at least listen to two local laureates in economics that we have in India, Abhijit Banerjee and Amartya Sen, and the policies that they are talking about, and the fact that the 20 lakh crore package actually boils down to 2% of the GDP if you demystify the 20 lakh. And how more, at least 10 lakh crores, that's the latest study they have shown, at least 10 lakh crores need to be put into direct provisions and direct provisions for wages.
Ma'am, I am sorry to interrupt you. Again, I would request all the participants to kindly mute their mic. You are creating disturbance in the presentation. So I humbly request all the participants to kindly mute their mic.
Isha, we are getting to be online digital educated. It will take a bit of time.
Yes, ma'am.
It's all right. It will take us a bit of time. We are getting educated. We are done very well. Faculties, teachers have done fantastically. We've all become tech savvy and all of that. And of course, the repercussions is maybe if you have another session with me, we will talk about the problems of online discussion. You gave me 20 minutes. Am I 20 minutes over?
Ma'am, the time is not at all an issue. You are just free to speak till the time you want to, ma'am. We all are just loving your session and we are getting the feedback. You can check the chat box also. Everybody is writing the message, excellent presentation. Can we please have this presentation? So I am damn sure, ma'am, everybody is loving this presentation. So if you want to continue for another few minutes, ma'am, please continue.
Is there any question? I think I would like to discuss more on questions because this is my framework. My framework is please, and everybody, please look at it from a scientific perspective. Let's not get into the rhetoric.
And I'll just check it out, ma'am. I'll check the list of participants, and if there is any question, we'll. If you permit, ma'am, I'll ask them to ask the question right now.
Right now, towards the end, whatever is.
Okay, ma'am. So the participants are free to ask the question. The only thing that you have to do, participant, is to raise your hand. Go to the participant option. The option is there, raise hand. Just click to that raise hand option and we'll allow you to speak and ask your question by the end of the session. Ma'am, please continue.
What I would want to really point out, I'm sure my co-speaker is going to rebut me, but that's the beauty. I mean, we both economists and we have very, very different positions on our understandings. The whole world is talking about the biggest spread of this pandemic, that is one. And second is there will be more such pandemics coming. So if we look into the last 40 years, and when I say last 40 years and aggressive neoliberal policies, the minute we talk about neoliberal policy in class, with students, with colleagues, with friends, there is so much of, support, complete support for privatization. Yes, privatization. Privatization creates growth and all of that. But we know about studies and reports that privatization, it has been the last 10 years, 15 years has been an era of jobless growth. See, we fell into this trap. I'm sorry, I'm going to call it a trap. Right from the 90s, when we went into this globalization, liberalization, privatization. And because of that, we aggressively pursued, when I say neoliberal policies, we pursued liberalization, opening up of the public sector. We practiced privatization. And because of that, the last 40 years, so it is not about A government or B government or C government. My position is very straight that we are a very typical country. We are a country with so much of population and so much of poverty. It is different for US to take up neoliberal policies. They have a social security network as far as the unemployed are concerned. We don't. So the way we borrowed the complete neoliberal package from the developed world is, to my mind, a cost that we are paying today in terms of insufficient capacities. So one fine day, we are all in support of privatization, that is the last 15, 20 years. And one fine day, we are all looking up to the government and saying that, you must provide all the requirements. No, that is not possible. Last night I was a pro privatization person, and today morning, because there is coronavirus, I want the government to address everything.
भैया भैया आप जब तक पावर बैंक को चार्जिंग पे ही लगा दो।
चार्ज तो है।
कहाँ है? दो ही हैं सिर्फ, ये येलो पे है, देखो ये देखो
लगाओ,
या
चार्ज पे लगाओ।
येलो ये
Participants, I humbly request you to please mute yourself.
Isha,
Yes, ma'am.
अरे भाई, we are all wearing, democracy is muted already.
Yes, ma'am.
और mute मत कराओ. So, and
हाँ मेरी वजह से चार्ज हो रहा है।
वो नहीं चुप होंगे.
नहीं चुप होंगे, ma'am.
वो चार्ज करके ही रहेंगे.
Yes, ma'am.
So it's all right.
I request participants, please mute yourself. You're creating disturbance.
अब इतने बड़े डिस्टर्बेंस में और क्या ही डिस्टर्बेंस होगा, ईशा.
Right, ma'am.
Okay, listen. So what I was saying is that there has to be academics and students have to take a long run understanding of a situation. Just because we say that SAM will give you jobs and therefore privatization is good, and government jobs would be, some sad litigation and all that. I think there is a very important to look at a balanced approach and look at a long-term approach. Long-term approach would say that when we so an economy cannot be so privatized. We know things like see, fundamental rights. See, for me, a right is a resource. When there is adequacy. So when is a right granted? A right is granted when the benefit of the right, social benefit, aggregate benefit, political benefit, constitutional benefit, democratic benefit of that right is higher than the cost of giving that right. Very, very simple idea. So the rights that have been enshrined in the Constitution, there are costs of giving those rights, right? Those are not free. I mean, there have to be budgetary allocations made for that. But the benefits of giving those rights are way more because there would be a rule of law. There would be the rule of law would create productivity. Productivity would create private investments, domestic investments, international investments. So I am relating the fact of fundamental right to economic productivity. Therefore, the fundamental rights that are granted, there is a cost to that. I mean, you cannot give health for free. Government cannot give education for free. Government cannot give liberty for free. There's a cost for that. But the gains of those rights are way more. I told you the gains of those rights are in terms of rule of law, are in terms of a secure business transaction region, which gives confidence for private investments domestically, which gives more confidence to international investors. So that's the economic value of the right. But in times of crisis, those rights get intervened, and when people like me or people like Amartya Sen, I'm sorry, I'm taking the names together, they are way bigger people, and Abhijit Banerjee and Karl Marx, for instance, when they talk about rights, only once the economic equality is attained, only then rights make sense. Otherwise, rights do not make sense unless there is a economic equality. The point I'm trying to make is, when you say intervention of those rights, please, everybody who's listening to me, please don't think it is intervention of rights and the crisis of the migrants. It is intervention of rights and the crisis of the MSMEs. No. It is intervention of rights, and maybe people like you and me, we could not order a pizza. We could not go to meet X person. No. That intervention of right has come to an extent where a middle class and upper middle class person would not have the right to a hospital bed. It has come to that. So the right is not starting from the violation of the poor or the vulnerable. That right has come to. So what I'm saying is, when you follow neoliberal policies, it's not about giving speeches about the poor. The neoliberal policies have created a scenario where you and I today are in a situation that maybe if there's a requirement, God forbid, there might not be a bed available. Now, what kind of an intervention of a right is that? So, a fundamental right is granted as long as the benefits of granting those rights, I just told you the economic benefits of those rights, are higher than the cost. And I also told you the cost of providing those rights. So, as long as the benefits are higher, but a crisis creates a scarcity, and the scarcity changes these equations. What did it change? It changed the fact that, well, today, now, the cost of you enjoying that right is way higher than the cost of my intervening in your right. You understand where the fundamental right does not become so fundamental anymore, because if you used your fundamental rights, then you're going to create a cost. And in that case, I intervene with your right. Having said that, do that. But while doing that, what is necessary is, you should have also, not from December of 2019, but 40 years, whichever is in state power, irrespective of the government, irrespective, I'm saying last 40 years, so you can understand what I'm saying. These fundamental rights, you should also have created the infrastructures, the productivity for people to enjoy these fundamental rights, because these rights are not just intervened with at the vulnerable level population, but the scarcity has brought intervention of rights to the upper middle class also today, and we don't know if it spreads even further, to what extent it will reach. So, point is the aggressive implementation of the neoliberal policies. The last point I'll make, Isha, is this. I mean, on this we can continue forever, but the last point I'll make is this: the packages that have been declared, the economic relief packages, stimulus packages, somewhere it is still based on monetary policy. It is not using fiscal policy the way it should be. Again, Amartya Sen, Abhijit Sen Gupta, they are telling us that you have to use at least 10% of the GDP for direct transfers, which means it has to be based on fiscal policies where your expenditures, already the fiscal deficit has moved beyond 5%. But their suggestions for the last 3 months is that it is not a problem. You can take it up to 10% to ensure that, cash transfer, direct cash transfer, wage implementations happen, and that would take 10% of the GDP. And I will conclude by saying I completely favor the lockdown. In fact, I'm not so much in favor of unlock one. I'm not so much in favor of unlock one. Unlock one would might not have happened in these situations where such high numbers are being reported, had 40 years preparation been made. That's my point. So ex ante preparations, had they been made, unlock lockdown was pertinent, important, but the background work of lockdown across the 3 months in question and across the 40 years in question would have minimized the cost of this lockdown. And the policy recommendation from my side is that increase the budgetary allocation for fiscal expenditure and not through monetary policy, because reducing of interest rates and reducing taxes on corporates would not create the aggregate demand that we are all talking about. So that would be the policy prescription. And yeah, and I'll take up questions now, because I think I've covered pretty much what I wanted to. We should not be scared of fiscal deficit. We should be spending, because that typical argument that fiscal deficit will create inflation is not going to happen today, because there is adequate capacity, supply capacities. Inflation will only happen when your capacities are full. So there is pent up capacity that can be utilized. And we should not, and we should also understand why the cap on fiscal deficit has come. It has come from a World Bank dictate. And we also, maybe some other time, if you want me to speak, I'll speak on international finance and the World Bank dictate of why capping. That's why we are not going way beyond our expenditure, because if we go beyond the 3% normal times, now maybe over 5%, but we don't want to go beyond that, because that would reduce the credit rating, investment rating of the economy, and international investments would fall. But international investments, in the sense of at least portfolio investments, have already fallen. There is already flight of capital. There is international investment will only happen when you have a strong economy and a strong demand. That can only happen through fiscal expenditure. That cannot happen through monetary policy. So already we were in a slowdown, and the slowdown was also thanks to neoliberal policy, and we are still aggravating that issue by not doing adequate fiscal expenditures, as suggested by Dr. Abhijit Banerjee and Dr. Amartya Sen. I think on that note, Isha, I'll kind of
Yes, ma'am.
Yeah, and we can take up questions as and when.
Yes, ma'am. First, I would like to say, ma'am, that listening to you is truly a treat to our ears. Thank you so much, ma'am, for speaking so long. And I've received a question in the chat box that says, what will be the impact on middle class family?
You know what? What is middle class family? I think I'm asking that question. What is a middle class family? So the government reports say that if you have, A, B, C, D, E, F provisions, facilities, then you are, and this income, then you are in the middle class, isn't it? I told you that the World Bank says that we are a lower middle class country. What is a lower middle class country? I'll just tell you. I'll give you the data. Yeah. So India is a lower middle class economy. A lower middle class economy is a household which earns between 70,000 to 2 lakhs annually. That's the definition of a middle class. So what I'm trying to tell you is this: when you say middle class, then there's a lower middle class and there's an upper middle class. Which middle class are we talking about? Why there's a huge distinction. A lower middle class is 70,000 to 2,70,000 annually is the income. Upper middle class is 2,70,000 to 8,45,000 is the upper middle class. So, why did I ask this? Because it is very difficult to actually pinpoint the middle class. So, 70,000 annually to, in figures, in income figures, if you want to know, then a middle class starts from 70,000 annually to 8,45,000 annually. You understand? So there's a dilemma. We have to. So which middle class are we talking about? These are figures of the World Bank. 70,000 annually to 8,45,000 annually. So which is the middle class? That's the question. So clearly, if you're talking about the upper middle class, again, see, it is so difficult. Upper middle class, 2,70,000 to 8,45,000 is the range. Now, what effect can I talk about 2,45,000 and 8,45,000? So this is your upper middle class. And so that's it. That's the problem. So therefore, and the percentage, the larger percentage of the middle class are identified within the 3 lakh annual income category. The broad middle class. So when I say middle class, I'm starting from the low middle class, 70,000 to upper middle class, extreme point, 8 lakhs. You take a mean in between, and we're talking about 3 lakhs something as the average. So 3 lakhs annually is the average of the middle class. If that's what we want to take, then middle class is going to be driven to the lower middle class. The middle class, if it is 3 lakhs, it is going to be driven to the lower middle class. To what extent, I don't know. I don't have the figures, but why? Because CMI job loss, 12.2 crore lost jobs. This is the data given by CMI. So these lost jobs technically would be amongst the middle class, because middle class primarily would be doing jobs. Small entrepreneurs are also going to face big issues, but these would be, the service class, mostly the service class. Of this, already 12.2 crore have lost jobs, as far as the CMI report says. So the middle class is going to be driven down to the lower middle class. That is my assessment based on the data that is available as of now.
Thank you so much, ma'am. Ma'am, now I think we have already have enough from you. We have taken a lot from you, in fact. And thank you so much, ma'am. Now I request our second speaker of the day, Dr. Hitesh Kumar Thakkar, sir, to kindly take over the session.
One and all present here. On the outset, I am thankful to Honorable Vice Chancellor Professor Balraj Chauhan, Professor Silpa Jain, and Dr. Isha Wadhwa for providing us wonderful opportunity for organizing this webinar. So already, Madam has covered the onset of the background of law and economics, and I think she has discussed both the side of the prevailing model, maybe Pigouvian or maybe coerce model. So I think my job become quite easy. I just have to go with some of the phenomenon, and I can discuss further. So it is need not to say that this pandemic has infected the human being, and later on it's spreading not only to the human, but it's now going to the economic activity also. We see that the people who are daily wage earner, they are facing the problem. People are facing a problem of individual insolvency, maybe issues of debt repayments are there, and there is a full uh, breakdown of the supply chain, because supply side of economics depend upon the variable call inputs, and presently in this situation I think all factors are fully depressed, and despite of the government uh, bailout, the government stimulus, still economics required more time to come to the normal case, yeah, in the gradual case. So generally, if any pandemic occur, then the most important job is that you require to create a nudge effect. I think everybody know the Nobel laureate Richard Thaler, his theory of the nudge. And generally, in initial beginning of pandemic, country like India, forget about India, but like all the country has started with the cognitive nudge to the reaching to the behavioral nudge, and everybody now are knowing what are the prospective precaution they have to know. In fact, I don't know, but my little son, 2.5 year, he always asks me to hands clean my hand with very with frequent interval. So the from the in the system, everybody is knowing what are the prospective precaution you have to take, and the social distancing, which may be not easy to implement in India, but now it become a culture and norm. You can see in the various market, if you're going, then people are following this social distancing. People are wearing masks because they know that if they're not taking any prospective precaution, then somehow somewhere they maybe have to bear some cost. Now, I think Madam was discussing about the asymmetric information. Personally, in economic, there's a quite interesting theories there with regard to the asymmetric information, and which is nothing but a lemon market, a used car market. But personally, when you are discussing about pandemic, then pandemic is not with regard to the asymmetric information. It is with regard to the incomplete information. So, the fellow further, I will discuss more about the uh, what was the difference between complete information, sorry, incomplete information versus asymmetric information, and then we'll move further. So, so, so there are some special research has been done, and it has been WHO. If you have seen, time interval has come and intervened and has given the updated information about the corona. So we know that it's virus spread through person to person, maybe contact one another, either with the cough, sneezing, and talks. There's a possibility that it can be spread, and the distance was initially was mentioned was initially distance was mentioned as a 6 feet. But now, if you see that later on, it was changed and it has been increased that it is not sufficient that 6 feet is sufficient. Maybe you may require more than that. Initially, it was believed that virus does not travel distance long up to more than 1 meter, yeah, less than 3 feet. But now the study when they have done in the restaurant, they found that it can go beyond 1 meter, and there was seen that strong inflow from air conditions should have been propagated the droplet. So clearly you can see that the information what you were knowing initially and information later on you are knowing, it is completely different. Like you were believing that it is not airborne, but later on WHO has also confirmed that it is airborne. So it is not with regard to the asymmetric information, it is with regard to highly incomplete information. And also we know that it can be spread with the number of things, like it may be through a computer mouse, it can be through exercise equipment, PC, iPad, reading glass, cellular phone, remote control, room surface. If any infected person has been touched to that some of the object, then possibility is that the virus will remain there. And generally we know that virus remain for plastic for 2-3 days, stainless steel for 2-3 days, cardboard 1 day, copper up to 4 hours. And so that means what prospective precaution and what right you are thinking, if you're not having a complete information, what are the prospective cost you have to bear, what are the prospective precaution you have to do, then I think it become very isolated viewpoint of discussing the individual right and government restriction. So this is a different level of cost what we are discussing here. So take this example. You can see here that generally in economics, uh, we discuss about the asymmetric information. You can see here that the one individual want to buy a car, and suppose buyer is thinking that price of that car should be a 3 lakh, and seller know all the complete information. So asymmetric information is that phenomena where one individual, yeah, one party is having a more information compared to the other. That means seller is having a more additional information about that car, and seller know that the price of this car is 2 lakh rupees. But when buyer is going and want to purchase that car, buyer don't know about the exact thing about that car, and from the outer look, he believe that the car is of 3 lakh. I don't know, but some of the nowadays you also, when you're going to purchase mango, I think seeing mango color, and if you purchase it mango, it does not mean that mango will be sweet. So from the outer look, you can't know that what mango you're eating that will be a good. So that is called asymmetric info. But the seller who is selling you mango is knowing which mango will be better, because he's doing business day to day, is knowing about the phenomena of which mango can be better. So in that case, what happened? The buyer make a decision, a purchase car, which is paying over and above the required price what seller was interested to get. So it is called clearly case of in economics, law and economics phenomena called adverse selection. So he make adverse selection, and this adverse selection may be result into the market failure. And if market has failed, there is need not to worry. Market can be repaired, market can be rearranged through government intervention. But when you are discussing about this incomplete information, you can see this is an infected individual is there, and these are the droplet. Either this droplet has touched to the hand, or either it has been touched to the devices, and later on, maybe directly, indirectly, that may be reached to the individual who may be infected. So that is one way looking what you believe. But generally, if you see here in this case, the upper case, it is saying that previously you were billing it is up to 1 meter, but now you can see it is beyond that. If droplet can, if it's airborne and if it can go beyond 1 meter, then clearly you believe that it was sprayed through the either hand gloves or either through mobile, but it was not the real case. The real case, it was the airborne. That means if you are not knowing complete information about the what is happening in this phenomena, whatever the precautionary, whatever the solution you are taking, that may not be near to the truth. You are taking some of the uh, step which are not per se of what exactly required for the this current phenomena. So this is a clear case of not asymmetric information. This is a clear case of incomplete information. And if you are having a incomplete information, then you can see there are two model can prevail. Either it is incomplete information, either it is asymmetric information. Already I said in asymmetric information, player one has more information over player two. Like player one know that the car is of 2 lakh, but player two does not know is 2 lakh. Is paying, is offering for 3 lakh, and ultimately is paying 1 lakh additional, and is making adverse selection. And ultimately, what in the long run, it result in the market failure. But when you see about incomplete information, clearly there is what is the gain, what is the loss, that is unknown to you. And there are unanticipated outcomes are there, and result is far from your expectation. So this is a different phenomena. It is not a market failure. It is a clearly the system as a whole failure. This is a macroeconomic system which has been failed, and now how to fix this thing, you required a different level of strategy compared to the what strategy we discuss in the case of the market failure. Now, generally, if you are discussing about market failure, Then when individuals are making decision, if you know that in generally the MenQ, how people make decision, so there are principles are there that we individually make trade-off, like either go to the in a lockdown, either we should breach the law, or we should not breach the law. And if we breach the law, what will be the opportunity cost? We are not knowing opportunity cost. You are knowing opportunity cost only because you have asymmetric information. You are not knowing, you don't have complete information. And what cost you are measuring, what cost you are giving, that may be higher than what actually you are calculating. And generally based on cost benefit analysis, you take decision to go out despite of the stringent lockdown. And why? Because this theory, all the theory of the economics work because we believe that human beings are rational and there is asymmetric information is prevailing, and based on that information individuals are taking decision. But when individuals are taking decision based on incomplete information, and they are responding to the incentive or disincentive, clearly whatever the decision they are taking, the result will be far from what they are expecting. That's what that has happened in the current phenomenon of the incomplete information. Now, the what Madam was telling with regard to the microeconomic theory, but generally in the macroeconomic literature, we know that there is a trade-off between individual right, that is a micro level, versus prospective damages to society as a whole. So what may be correct for the individual, that may not be correct at the system as a whole. That means I want to say that what is right for the individual level, for the micro economics, for the individual per se, may not be right for the system as a whole. So when we discuss about government restriction and individual right, we have to understand that this is not with, if somebody is breaching the lockdown norms, or somebody is breaching the lockdown protocol, somebody is breaching the quarantine protocol. So they are not breaching per se of tort liability, or maybe not per se of the contract liability. They are not per se of private law liability. In fact, this is law per se of system as a whole. That means they are breaching the public law per se. And if you're knowing that, then and then only I think you can better estimate about the cost benefit of the what is correct at micro level may not be correct at the macro level. You can see this uh, uh, yeah, framework of the law, maybe public law, maybe private law. So the best example of public law, we know that the constitution law. And when we are discussing about constitutional law, then we are discussing as a system as a whole. So this right are always protected, but except the case of emergency, and pandemic was also one of the emergency, or maybe reason of because of externalities. And when you are discussing about public law, you are discussing as a system as a whole. And if you are any breaching public law, that means you are not that means you're the enemy to state. You are breaching the whole state laws. And when we are preparing public law, we uh, consider the public interest in mind. Why? Because we want the social benefit in our mind. But when you discuss about the private law, what are the individual rights? Generally, individual rights are nothing but they are the part of the private law, and they are nothing but relationship between individual, where the protection of individual rights are being given. And assuming any breach of that individual rights are there, then that can be asked to the additional other individual whom they have breached. And this is nothing but the perceived concept of the microeconomics, and nothing but the concept of the individual self-interest, and later into the private benefit. Now, when government is restricting individual right, that means government is restricting the individual right. But this individual right, if they're breaching, they are not breaching per se of uh, the one additional individual, because already Madam has told that the externality is quite high. If any infected one is going to the some places, you can clearly know that if it's infecting and it is a asymptomatic case in nature, then it clearly can be spread to the other persons. So that means you are not breaching per se of per se of public law, but you are breaching per se of the you are not breaching per se of private law, but you are breaching per se of the public law. And the the repercussion may be comparatively higher than the what repercussion are there in the tort law. Now, what the was discussion by the in the previous about the Cosian model versus the Piguvian model. So India adopted clearly with regard to the Piguvian model, and we have given a complete lockdown to the all the system except to the necessity thing. And we know that this complete lockdown are we're having an additional cost to that. But there is other model, which course model is there, which is based on the market forces, which is based on the asymmetric, which is based on the symmetric information phenomena. So now, when you see in South Korea, they are generally not full the strict lockdown. People were working, maybe odd day, one day they have come out with the strategy. And the ultimate thing, they were having a prior experience of outbreak of MERS in 2013. So for their incomplete information will be slightly different than the what incomplete information maybe some other country may be facing. In fact, they may have a slightly lower due to the previous experience of the MERS in 2015. In fact, they started implementing enhanced quarantine screening measure for the visitors from Yuan from June January itself only. In fact, over and above, though we discuss about privacy, we discuss about sovereignty. So you can see they were tracking the cases through credit card record, GPS, security camera footage. So in fact, the privacy was also right to privacy was also taken from them. So that what individual right you are having, that was also taken by them, and they were making sure that if any suspected person has been seen through any other mode, they would like to first taste it, and if it fine, then they would like to quarantine it. Over and above, in fact, the people were self quarantine themselves on their own. So there is no requirement. If you have such phenomena, then the Cosian model may work properly. And if you are if you are knowing about the what is the social distancing, what the phenomena you have to follow, then if India has not done lockdown, then it may be good. But in case of India, the possibility with regard to this additional thing may not be there. The size, population, are the different than what we have seen in the Korea. Forget about the Korea, maybe one of the exception outlier, but what we have seen in the US, in fact, US also has followed the same thing, and they also have initially gone with the market forces or Korean model, but they could not outbreak this virus, and in fact, currently it's a highly affected uh, pandemic place, and and later on they realized that now they has to go with this stringent lockdown. So so what strategy India has adopted based on our incomplete information, I think it is correct, because we were not we were not in position to forecast what may be ultimate result. Generally, uh, if we were having a previous additional information, if we were knowing what can be outcome of that, what can be result of that, then slowly gradually we may have not gone with that stringent lockdown what we have started in 31st of the March, at the end of the March, till it continue, where in the second lockdown, in the current unlockdown stage, we have not fully relaxed all the things. Some of the places which are highly infected, I think the states has power to decide whether they want to unlock, they want to still continue with the lockdown, and all the states have a different policy per se of per se of their overall cases, yeah, overall infrastructure. Now, generally, the lockdown, I don't think there is requirement to think about the violator or lawbreaker. But we have seen that the corona warriors, the people who were the frontliner corona fighters, they were facing unnecessary hurdles from the lawbreakers. And generally in economics, profound theory whether sanction will deter or whether fine will deter. So we have gone with the both the model. We have come out with the fine also, and we also have come out with the punishment. I think if you are aware, then in the current amendment, it is also now a penal provision. So anybody can put in the bar also if the grievance is comparatively higher. And if you are not wearing mask, certain amount of fine is being described, and that is also to be paid. Uh, but if you go with the some other countries model, I think they don't require such fine and penal provision, because there may be possibility that uh, in the Seoul they already have seen that uh, the prospective losses, a prospective precaution what has to be taken during mass, they were they were knowing, so they have taken care in the current pandemic of the COVID-19. So I think the present case is slightly different. When you go to now to the market or go to any system mall, I think people are taking all sets of precaution. They are fulfilling, they're following currently the nudge effect. Everybody, it's now nudge is not normally with regard to the cognitive nudge. Now it has become a behavioral nudge. Everybody wear mask if they go out. They clean their hand frequently. They are taking all sets of the respiratory hygiene what they has to follow. But in the law and economics, the fine versus punishment argument is there whether uh, that has created any nudge with regard to the lawbreaker or not. We can understand through only very simple game theory model. So if somebody is law breaching, and if we put high cost, if individual break the protocol of the lockdown, then what will happen? You are creating a deterrent effect. So this is a single round. But let's say that somebody is law breaking and you are not putting high cost and you are allowing as a free rider, despite of the protocol of lockdown has been breakdown, then it will be not create deterrent effect. What will happen? There will be a free rider, and clearly in the repeated game theory, here assuming deterrent is there, then clearly you will have a less matter in the future. And if it's a challenge in the court also, then also court is also going with the intent of the law, the number of default may further reduce. So clearly, if you're following high cost of deterrent, clearly high cost to the law to the breaker, the protocol lockdown, then there will be high deterrent of the prospective defaulter. So in repeated game theory, you can see that less is happening in the future, and number of default also has been reduced. But if you are not taking the high cost and if you are allowing and if you are making them free rider, then here it will be not deterrent. Here clearly what will happen? There will be more free rider will be there, and this will be not less. The matter may further increase, and people will be taking as a granted may, and the problem may be aggravated. So that's what this can be known through this the present what uh, game theory model. Now already Madam has covered with regard to that fiscal stimulus versus monetary stimulus. Though this global challenge is may not a global challenge, but country now feeling that as a global opportunity, and there is age to go with the quantum jump, and that is nothing but now we can revive and regenerate Indian economy with the greater height. With that mindset, India has come out with the 20 lakh relief package. And generally, later on, it has been realized that package is not only fiscal stimulus package, but it is a combination of both fiscal and the monetary stimulus. And generally, the comparison of monetary stimulus is higher than the fiscal stimulus. But irrespective of that, if you've seen that uh, the the country were identifying the problem and they were making sure that whatever the problems are there to the stakeholders, they were coming out with the guideline every frequent time interval, and they want that economy should not go in fully hell, and making sure that all the stakeholders which are involved in that stakeholder, they get correct information that we are with you, and there will be a position and decision will be taken so that system does not collapse. So if market failure is there, then current that can be resolved through the a very small reform, yeah, some of the mechanism where which maybe have given a wrong signal to the market. This is not per se of market failure. This is a clear case of the incomplete information, and it is irrespective of the developed versus developing country. I think everybody were not knowing the accurate information of they were not knowing prospective precaution of the what they have to take care during this pandemic. And maybe case of India may also may be there. And on that line, if you see that the system has already get uh, the system has now become fully fragile in the economy, and if you want to boost system, then somehow somewhere you have to intervene. And this intervention initially first in April month it was done by the Saktikant Das through monetary stimulus, and the later on our finance minister Nirmala Sitaram has come out with the fiscal stimulus package. Now, there may be debate and discussion that the proportion of what a fiscal amount has been prescribed may not be per se of the what has been given in the monetary. But I think the government is closely watching the economy and system, and if they find that there are loopholes and there are some things which are not giving the correct message to the correct signal to the economy, I think they will rightly time they will intervene, and they will make sure that system may not go to the outtrack, and somehow somewhere the global crisis will be created as an opportunity, and the country like India will have a bigger quantum jump so that we can revive and we can regenerate our economy with the greater height. So I think I will just summarize in a nutshell that personally, when you see this phenomena, then it is it is per se of look like the asymmetric information. But personally, what I feel, this is not case of asymmetric information, because in asymmetric information, one individual is having a more information to compared to the others, and in that also, when outcomes are coming, then one person is knowing that he's getting better than others, and ultimately one person is making the adverse selection, and that is result to the market failure. But this is a clear phenomena which is of incomplete information, where you are not knowing what are the prospective precaution you have to take. And generally the virus which are linked with the DNA and RNA, it is quite hard to develop vaccine, because the this phenomena was not prevailing in the previous uh, pandemic, and this is quite new phenomena. So I think whole world research or science communities are working quite hard with regard to making that this incomplete information now become reaching to the partial complete within the month of July end, and they are working quite hard. Some of the already vaccine company with the joint collaboration with the Oxford, they are claiming that they will come out with the vaccine soon. But somehow somewhere we are moving toward the incomplete to the partial complete information, and slowly I think world will move to the complete information. And now the involved stakeholders are knowing what are the prospective precautions they have to take care. So the initial lockdown has given a clear signal to the all the stakeholders that they have to follow the protocol, they have to follow the respiratory hygiene. And you have seen that now in the phase one of the unlockdown, people are following this respiratory hygiene. Still number of cases are increasing. So it is not right time to comment on what will be the ultimate result. But the number of cases are not quantumly rising the way it maybe have thought with regard to the unlock situation. So and so that means local transmission is happening, but due to the incomplete information become the at least partial information, yeah, at least complete information. So that is providing better knowledge to the individual. And now they are having their, when we have unlocked down them, where we now have given them right, now they can take their decision according to what are the risks associated with regard to the, if they are going against this protocol, and what will be benefit they will derive. So I think in that I am, I think I am closing my part, and I'm thankful to one and all, and I'm looking forward if any question are there.
Thank you so much, Thakkar sir. Our participants have raised their hands. Dr. Pushpa Ramesh, Assistant Professor of Mata Gujri Mahila Mahavidyalaya, Madam has raised her hand. So I request Madam to kindly unmute yourself and ask the question. Pushpa Ramesh, Madam, kindly unmute yourself so that you can ask a question. Moving to the next, we have Dr. Shailendra Mishra sir, who has raised the hand. Shailendra Mishra sir, kindly unmute yourself so that you can ask the question.
Hello.
Yes, sir. Go ahead with your question, please.
Actually, madam, it is by default. I am just doing for chatting, and by
Oh,
default,
okay.
it is happened. So I have no
Okay, no
question.
issues, sir.
But
No issues, sir.
uh, I want to say only few words that the session was very nice and informative, and thanks myself for team for doing such type of webinar. I am Dr. Shailen Mishra from Devi Ahilya Vishwavidyalaya, Indore School of Commerce.
Thank you, sir. It was very nice to hear such appreciation words from you. And I think we have finally come to the end of the session. We have already taken a lot of time from our honorable speakers of the day. So before we end the session, I want to express my heartfelt gratitude to Madam and Sir. It was truly a very insightful session. I'm sure our participants have benefited a lot by attending today's session. And to deliver the vote of thanks, I request our student Aditya Puri, student of BLLB Honors 4th semester, to kindly deliver the vote of thanks. Aditya Puri, kindly unmute yourself.
Thank you, Isha ma'am. Good afternoon to one and all present here. Respected Professor Balraj Chauhan sir, Dr. Shilpa Jain ma'am, Professor Ranita Nagar ma'am, Dr. Hitesh Thakkar sir, Dr. Jalaj Guantia sir, Dr. Isha Vatva ma'am, guests, and my dear friends. Before I begin with the conventional vote of thanks, I would like to acknowledge that both our respected guests are critical in their approach, especially Ranita ma'am. I know that it is difficult to make such analysis. Also, such analysis is very crucial to be made since it is absent in the media that garners the maximum viewership. And hence, I recite a couplet from Faiz Ahmed Faiz, who says, वो बात सारे फसाने में जिसका जिक्र ना था, वो बात उनको बहुत नागवार गुजरी. खैर, दिल ना उम्मीद तो नहीं, नाकामी है, लंबी है गम की शाम, मगर शाम ही है. And we will come out of this pandemic very soon to back to our normal life. I, on behalf of all the participants and myself, extend our heartfelt gratitude for your contribution and cooperation. After the illuminating session, I am feeling intellectually enriched and personally honored that you accepted our invitation despite your busy schedule. Sir, ma'am, I thank you for sharing your enlightened insight with us today. I look forward for more such talks in future and in person, particularly once this pandemic subsides. I extend my gratitude for our beloved Professor Dr. Balraj Chauhan, Dr. V.S. Jijiman, uh, Dr. Shilpa Jain ma'am, who's my mentor, and who has been in the forefront for making efforts for this wonderful webinar series that we are having. I also express my sincere gratitude for our proctor and our protector, Dr. Jalaj Gontia sir. I congratulate Dr. Isha Wadhwa ma'am for the successful conduct of this webinar. I also congratulate all the participants, and I'm happy to inform you, ma'am, that today we have guest faculties from all across the country, and
Yes.
which is a huge honor for us. And uh, I also congratulate all other participants that belong to our college. And in the last but not the least, uh, special gratitude for my friend Arpit Sanjar, who has been coordinating with all the students for this webinar. Thank you so much. I feel obliged to everyone present here. Thank you so much.
Thank you so much, Aditya Puri. And it was a humble Tiwari. She also wants to deliver the vote of thanks. So I request Aditi Richa Tiwari to kindly unmute yourself.
Hello.
Yes, Aditi, you're audible.
My heartfelt good afternoon to Honorable Vice Chancellor, sir, to respected speakers of the session, the faculty coordinators, respected professors, and all students who are present in this webinar, and of course the participants. It was such an insightful session, and we could not have got more from this session than the speakers have delivered. The first thing that I found in the session was that the arguments of the speakers were based on scientific lines. So, although we all must be having our own perspectives to the present situation, however, a true academician's work is to deliver the scientific perspective, which I think we all have successfully got from this session. So, I'm thankful to the honorable speakers and to the faculty coordinator and each one of the participants that made this webinar a success. Thank you so much.
Thank you so much, Aditi. Before we end this meeting, I want to give my Before we end this meeting, I want to express my heartfelt gratitude to Honorable Vice Chancellor Sir for giving me the permission to conduct this webinar. Without your permission and support, this webinar would not have been possible. And also, I want to thank my student team. All my students are my backbone. Without your support, I am nothing. And also want to express my heartfelt gratitude to all the participants for giving us their valuable time. Without your active participation, this webinar would not have been possible. So thank you so much, everyone. And thanks for joining.
Isha, can I say something, please?
Yes, ma'am. Yes, ma'am, please.
Yeah, so many congratulations to you, Isha, for the effort that you put in.
Thank you so much, ma'am.
And yes, and I think your students are brilliant.
Thank you so much, ma'am.
Beautiful shairi he spoke. What's his name?
Aditya Puri.
Aditya Puri. Aditya, you have fantastic hold over Sher Shairi and a very relevant share you spoke.
Thank you so much, ma'am.
And Aditya also, and your entire student team. And I really would say that we look forward to more such sessions. The participants, I mean, so many learned academicians are a part of the session, which makes us very encouraged and makes this a very valuable time to talk about, because you got the I think the dimensions you got was one. Between Dr. Thakkar and myself was that we agreed on the lockdown, we agreed on the government intervention as far as the lockdown is concerned. But of course, I had a few pointers in the sense that, like I said, that we need not only, if it is globalization, then we don't learn only military exercises from other countries or supply chain management from other countries or internet technology from other countries. We also understand how to deal with pandemics from other countries and have those infrastructures in place so that the incomplete information is minimized, because we are looking at a minimum cost solution to this crisis. And information asymmetry was Dr. Hitesh, and for participants from my side, it was this, that it is cheaper for the government to provide information. So market failure in the sense of government provision, not about the fact that is it incomplete or is it asymmetric. It is the fact that the government can provide these information at a lower cost. In that case, it was information asymmetry. And incomplete information, once again, we really are not in this day and age, we cannot really accept the point of incomplete information, because we should have better information. And also, when we talk about the high cost of deterrence, we must also see that, we are not talking about a homogeneous income group, and therefore this high cost of deterrence might not only minimize this violation, but it might also create a lot of cost on the already vulnerable sections of the people, because like I said, fundamental rights are determined separately. At times it is livelihood which is more important, and that should not be taken as violations unless proper provisions have been made. So I'm sorry, Dr. Thakkar, I took the last time to wind up with my points, but you can come to my cabin, we will talk more about it. So Isha, thank you very much, and hope to see you soon again.
Yes, ma'am. Thank you so much, ma'am. Thank you so much, sir. All the
Thank you.
participants are requested to kindly fill the feedback form. The link of the feedback form is provided here in the group chat box, and I will personally send the link of feedback form to your email IDs also. So if you find any difficulty in getting a feedback form in the chat box, do not worry. I will personally send the link for the feedback form in your email IDs too. Thank you so much. And finally, we can end